sculpting.
Filler Friday.
Filler Friday. We're here at Central Park, and we're going to do a real masculinization makeover, strengthening those male masculine features like the chin, the jawline, cheek, and temple. It's going to be great. We have a very good looking man here already with nice structure, and I just want to build on that structure. Guys tend to lose volume in their middle face, their temple area, and they lose some structure in the jawline and chin as people age. The mouth kind of caves in, the nose caves in, so all those areas need some volume to lift them. So we're going to start from the top. We're going to work away in the temple first. He already has some of that. Remember I tell you guys the temple is like a swimming pool. The top part being more superficial, the bottom part being more deep. So here we are working on at least a little bit on that top part because most of the other part of his temple is pretty full. And we'll kind of even it out. We're going to use Radius here, which is our calcium-based filler.
We have people saying hi, Chi. We have Renuvia, New York on here.
Hey guys, Renuvion. We're going to be doing a live surgery on Monday for you. So stay tuned for that. We're going to go to the other side. I'm going to come around here, switch it to you a little bit. Do that same thing over here. In the mid-temple, we're going to go all the way down.
Good-looking client. Everyone loves to hit on our patients.
They do. Send in your resume and your bank statements, please. Let him know. We'll let him know, okay?
Headshots.
Exactly, headshots. So you guys can see that temple filled nicely. It's a little blending there. It looks real good. We're going to work our way down now. And again,
do you use extra lidocaine in Radius when doing temples?
You know, we always do a certain amount of mixing. Radius, remember you guys know in 2007, I did the mixing kit studies that got Radius mixing approved between 0.26 and 0.3 cc's. We tend to do a little bit more nowadays. We want him again to have that more masculine look. So we're going to build out, strengthen. Hey, happy Filler Friday. He's doing great. And again, as we age, we want to widen this a little bit because we want the jowl area to be supported. It supports the corners of the mouth. It supports... And I really feel like the chin and jaw really give that structured, real structured look. What do you say?
It's like a mirror. We gotta wait till the end.
I know. Can't look yet.
No.
It's not even done.
We'll do the Emer reveal when he's done.
Yeah, we're going to do an Emer reveal. And he's an athletic guy, so we need to have an athletic looking structured face.
Do you want to know how old he is?
A little bit. That I don't want to tell you guys. How old do you think? That's the question. How old do you think? We don't tell.
We age backwards here.
Exactly. Okay. So each area usually requires a couple syringes. Long term, we could use Bellafill. Turn to me just a little bit. Perfect. Long term, we could actually use some Bellafill, which is a more permanent filler. Like widening this is really important. Sort of that line structure so you guys can see. Even if you come from the side, you can see it. He really likes that
PCL or HA?
What's it again?
Do you use PCL or HA?
Well, I don't know what they mean by that.
This is hyaluronic acid. It's not a hyaluronic acid filler.
Right. This is a calcium. This is CLLA.
Is he single? They're asking.
C8. PLLA is what some people will use build collagen over time. But HA isn't going to give him this much structure like he has now. So that's why we're doing this. This is really going to build out the jaw and the chin. That looks really good.
Very happily single. Very happily single.
Exactly. You know what? Enjoy it. Enjoy it. I watched a video this morning, a TikTok grandma that's going viral, saying how happy she is being single. So
that's me.
You guys, but we could take applications just in case. All right, turn this way a little bit. So we're going to build a little bit of structure at that 90-degree angle for him on the jaw, just a little bit. build some shaping. I don't want to widen him too much, but I do want him to have that more bold look because that's what he's going for.
How many syringes are ready? Yes. If you guys are here, you guys keep counting with us. You've been with us from the start.
There's a lot of syringes, but the thing is, you guys, you often need numerous syringes.
It's how you use them.
To be able to sort of contour different areas. So
Is this the side needs more?
yeah, that's where I'm going right now. So you can see it's pretty straight here, so we want to bring this line to come back a little bit. So we're going to build that line. This side, it needs a little bit more, but a little asymmetry naturally. Question is, can we get it to be a little bit more symmetrical using the fillers? I think we can. I'm going to stay on this side. What are they asking there, Jordan?
More so being on our patient than asking questions.
Okay, well, they're excited for the weekend, I guess.
Maybe he'll comment back to you if you guys
Friday.
comment on the live.
We should
Maybe
call
he'll
Filler Frisky Friday.
Frisky Filler Friday in New York City.
Oh my. They're going a little crazy. So we're
A lot of people in
trying.
here.
That's good. We're trying to build, and I want to, not only build the strength of this jawline here, but I also want the line to be more defined at the angle. Good. Hold on 1 second. Just wait 1 second.
How deep do you go to make the jawline?
Depends. Sometimes we're on bone. Sometimes we're in tissue.
How long is
depends
this going to last?
This will last about 18 months. What I was telling him was as it goes down, if he really likes the structure, then what we should do is use a more permanent filler like Bellafill so that he gets more structure long term. Eventually, maybe even doing some neck tightening things to pull it in even more. Oh yeah, looks great. Now the thing with cheeks, you guys, and under eye, you want to be really careful with. Guys, we want to go a more horizontal approach, like an implant. So we really want to use this on bone as if we were just to build structure. Laterally.
Which do you like better, doctor? Working in New York or LA?
I like them both, and I like Boca too. We're doing them for different reasons. We're doing them for different patient populations. We have so many great clients, right, Jordan?
We
In
do.
terms of filming, you
We
love
love
it?
all of them. The
Love
New
them
York
all.
ones are pretty strong, I will say that.
Yeah, the New York ones have definitely a strength to them when it comes to these treatments. My
Look at him!
3 of my patients yesterday didn't even do nerve blocks for lasers,
For big lasers.
for big ones, including CO2. One of my clients drove 9 hours from Canada, and she said
Got her big laser and drove right back.
she got a CO2, and she said when you work outside in that weather, you can do anything. CO2 is like nothing.
That's also close to the cheekbone, right?
Yeah, it's right on the bone. Yeah, it's a little more. Hold here, Rosa, for me. Cool. I'll switch with you. Over there.
Got a Dubai office?
What'd you say?
Going over and have a Dubai office.
Well, we have our Dubai and Abu Dhabi licensing now. So the question is when we start. Let's take a look. I don't know yet. We'll see. I want to.
You guys that want to
That's
see
really
us there,
good.
send us a DM. We'll get you on a list to be the first ones called.
I'm gonna go back there, Rosa. Switch. Sorry. I know it's our little dance. Good. So I'll make sure now.
So that's what are we doing to him? This is mean male facial sculpting in New York City.
Yes, this is our masculinization, aggressive sculpting.
Say mean mother or something.
Mean mother something.
Me and MF sculpt.
Someone's Saiton's on here saying that's a nice Jewel X in the corner.
These will be used in a minute.
We've been using it a lot.
A lot of treatments.
Thank you.
All right, so that looks really
How much
good.
does this cost? That depends on the amount of fillers needed. You guys have to send it a DM, full name, email, phone number. We'll see how many you need to get to your goals. And there's our Julex with the view side time.
So I'm also gonna do just a teeny bit onto the bridge because he wants this bump to look a little less noticeable. So what we're gonna do is we're gonna use a little lift, Restylane Lift.
We want to know what is the name of the actual filler, the one we were using before.
That was our radius.
That was our radius. Now we're doing our lift.
Just doing very little to the bridge, very small amounts. And you can see already that alone definitely made a big difference. I know the look he's going for. So you guys can see already if you come from the side how much straighter that is already. You guys see already.
Wow.
Much straighter.
If you want to see us in Toronto, then maybe some of our friends with Julie.
Well, we're looking right now. We're looking right now actually to get credentialing there, so stay tuned. And the last part I'm going to do to make this a little bit straighter is we're going to use a cannula. Just do this while we're here.
And we'll bring all the Emerald skin with us to see Queen of Face.
Oh yes, we love Queen of Face. It's our fave. Okay. I'm going to lay him back just a teeny bit more. So we're going to do a technique now to straighten this and give a little support. There's going to be a little pinch in the middle.
They're
1,
lucky
2,
to
3.
see. We rarely do this
I don't
online,
show this
guys.
a lot on a live.
So you guys are very lucky to see
Because
this.
it does hurt a little, but he's really strong.
Do you ever come to Miami? We go to Boca. We fly into Miami, but we do have an office in Boca Raton.
Take a deep breath. 1, 2, 3. Breathe out. Good. Sorry.
I'm okay.
Good. He did really good. So now we're gonna strengthen the septum. It's just gonna feel weird as we do this. A little pain, it'll disappear in a sec.
Sid, you remind me of a cool doctor from TV. You might be on TV soon. Watch out.
And then what we're gonna do, weird pinch. 1, 2, 3. Good. Very good. There we go. Great. So we're right in position there. Strengthen this a little bit. So he wants a little more bold and a little straighter.
We're using Botox. No, guys, we're using filler. What is he doing? We are doing a non-surgical rhinoplasty right now with filler to help structure our patient's
There we go.
nose.
And he wants this like really straight. There we go. So that's just a technique a lot harder to do. I'll show you guys in a second. You take a look now. Look at the nose. He's doing great. All right, 2 more, you get a break. With men, you want to keep the lower part a little bit bigger than the upper. His upper is a little more challenging. So we're gonna focus last pinch, get a break. Good. Perfect. Take a break. His upper lip tends to have very little on the side, which means you fold over. So what you need to do is lift it.
Do I know
Okay.
what we're using for?
Because it's really soft. Okay, we're starting on the top. Deep breath. Good. Okay, another one, a little bit. Good. Okay, let's go to the other side. Very little. Doesn't need a lot. Again, we want to keep him masculine. Not we don't want to soften too much. So you can see now he has a bit more show to the upper part of his lip. I can probably get a little bit on the side on each side. Hold on. Just a little to get it to raise because I know he wants a little bit on the side. Last. Good. All done. All right, so let's wipe them. Do it.
The phone.
You're gonna love your nose. Honestly,
My
I think
nose
that
is
made
great.
everything. That like put everything together. Came out so good. So obviously, you guys, I always tell people, especially with radius, tends to be about 2 weeks to where we see the final outcome. Sorry, the alcohol. But you know, it's more structured. And nose, I tell people the swelling for nose filler takes same thing about a week or two, but you can see much less of a bump, much straighter. Very good. All right, let's give him the phone.
All
Let's
right, here we
what we call
go.
our Emer reveal.
We're gonna pass
Let's
our page to the
wipe his
phone.
eye. Hold
Here
on.
you go.
Close your eyes a second. I'll wipe you. Okay, give him the phone.
All right, let
Grab
you hold
the
the phone. Hold the
Grab
phone.
it. Yep.
Hold the
with
phone
your
like you're
hand.
taking a selfie.
And take a look and see what you think in terms of the structure. I know it's hard to see in the light. We're gonna get a mirror on you, don't worry. But what do you think? What were you looking for?
Great.
Do you see how we built this out a little bit so it's more structured and square? Built this out so it's more structured. Nothing crazy. The chin, yourself kind of 45. Yep. More structured and bold. Actually helped the jowls a lot. And then look at your nose. I want you to see your nose. Can you see it from the side?
Yeah, amazing.
Great. So I'm going to show you on the other side. In the mirror, you'll see it better, but look on this side too. See? Much straighter. So we wanted that masculine look. Do we have a mirror?
Yeah, right here.
Oh, good. So here, now give that back to Jordan. Now look, you'll be able to see it better.
Yeah.
What do you think?
Fantastic.
Much more structured, much more square. That I know that's gonna be the harder part, but a little bit here in the future I think will be good. This is more bold, which I think helped your under eyes a lot.
Yeah.
Did a little bit more to the temple to blend everything, and then just squared it off.
Okay.
Doesn't look feminine at all, which is what we wanted. We really wanted that squared, bold look. Do you think we got it?
Yeah, absolutely.
Perfect. All right, you guys, another male facial sculpting. Man, stay tuned for more.
Thank you.
I'm gonna do one more pinch on the upper part of your nose. When the swelling goes down, I see what